Good afternoon and good evening to everyone from across Canada who's joining with us today. My name's Troy and I'm a director with Ostomy Canada Society, and I'm so excited to welcome you to today's National Ostomy Canada Society webinar. We couldn't have done this today without our sponsors and partners, Coloplast, who are able to give us this phenomenal education today. Today's webinar topic is going to be on eating and living well after your ostomy surgery, and will help you understand the importance of a balanced diet and adequate hydration after an ostomy. The webinar will also cover topics such as basics of ostomy creation, lifestyle tips and tricks, and effectively managing challenges such as pancaking, odour blockages, and more after your ostomy procedure. So just before we get started, I wanted to remind everybody that this webinar is inspired by Coloplast's newly introduced ebooks called Living and Eating Well After Your Ostomy, and they're available for download on the coloplast.ca website. Before we get started today, I want to just introduce briefly our two presenters who you'll see in just a moment. They are Natalie Kameka and Rory Hornstein. And once we get started with our recording, you'll hear from them. We'll also have Natalie, who will be coming on at the end of the presentation to help answer some of your questions. And I want to thank everyone who's already submitted questions from across Canada. We've taken a full archive of all those questions that have come in, but we still recommend and encourage you to ask a question throughout the duration of this presentation. And you can do that by clicking on the Q&A tool in your toolbar. You should see right beside where you could see potentially people or your camera and mic button. You'll see a little Q&A symbol there, and that'll give us an indication that you want to ask a question. We'll hopefully get to that at the very end. So without further ado, I'm very happy to pass over the mic to our two presenters. Thanks so much.
For joining our webinar today on eating and living well after your ostomy surgery. This is our disclaimer for today's presentation. The information is for educational purposes only. It is not intended to substitute for medical advice and should not be interpreted to contain treatment recommendations. You should rely on the healthcare professional who knows your individual history for personal medical advice and diagnosis. This is the agenda for today's session. We'll be reviewing some ostomy basics, some dietary health concepts. We'll also discuss some of the dietary restrictions after your surgery, and not just the restrictions, but also foods and fluids that you can consume. We'll also explore some hydration tips, how to prevent and manage different issues you might face with an ostomy, some lifestyle tips and tricks, and then we'll review a patient support program that will help you along your ostomy journey called Coloplast Care. So these are your hosts today for today's session. We have Rory Hornstein. She is a registered dietitian specializing in nutrition for sports, weight management, eating disorders, immune system enhancement, and digestive disorders. Rory is also the designated nutritional consultant at the Inflammatory Bowel Disease Clinic, Division of Gastroenterology at the University of Calgary through her private practice. My name is Natalie Kameka. I'm a registered nurse. I'm also a nurse specializing in wound ostomy incontinence. I have a master's degree, and I am employed as the clinical lead for chronic care at Coloplast Canada. I provide clinical expertise in the area of ostomy incontinence care. So what is an ostomy? We know that some people on the call might be very familiar with this concept. Some were just learning about ostomy for the first time. So an ostomy is a surgically created opening that is created in the abdomen. So what happens is a piece of intestine, either the small or large intestine, is pulled through an opening in the skin, and then that piece of intestine is brought to the surface of the skin, turned kind of over like a cuffling or like a turtleneck when you roll your turtleneck down, and then that piece of intestine is stitched to the skin to keep it in place. And what that pink stoma that we see right here, where stool and urine will come out of, is called the stoma. It's also either the small or large intestine that you're seeing. And there's different types of ostomies. We have three main types, and those are ileostomies, which are created in the small intestine, colostomies, which are created in the large intestine, and urostomies. And how we create a urostomy is by using a piece of small intestine to divert urine into your ostomy pouching system. And what happens is either the bladder is removed, sometimes it's not. But once the bladder is removed, we need to get urine out of the body. So the ureters, which normally connect to the bladder, are actually going to be stitched in to that piece of intestine to allow urine to come out through the stoma. And so, as you may expect, the output for the different types of ostomies may vary. So for instance, we have an example of what thicker stool may look like, and that's usually typically seen with ostomies created in the colon or colostomies. And that's because the job of the colon is to reabsorb water back into your body. And so because that process may still be allowed to happen, depending, of course, where that ostomy is created along the large intestine, the stool will tend to be thicker. That being said, you can still get soft stool, diarrhea, all those things can still happen, but this is what we tend to see with these types of ostomies. And then we have more liquid stool, which can be more, it can be watery, it can be mushy, it can be like an oatmeal consistency, can have fluffy pieces in it. And that's more typical with an ileostomy. And that's because the stool hasn't had a chance to go through the large intestine where that water gets reabsorbed. So a lot of that water gets lost out into your pouch. So those individuals with ileostomies tend to be more at risk of dehydration because they're losing a lot more fluids and electrolytes into their pouch. And then we have urine, and that is what we may expect with someone with a urostomy. So why might someone have an ostomy? There's a whole list of different reasons why. One of the common reasons I had been familiar with in my practice was cancer. So what happens is someone might have a bowel cancer and they will remove the cancerous piece of intestine, stitch the ends together. They might have an ostomy that is temporary. So they will actually reclose that ostomy down the road, or it might end up being a permanent ostomy. And there's a whole list of other reasons like trauma, comfort measures, people that are fecally incontinent so they can't control their stool. Also, a common reason is inflammatory bowel disease, such as ulcerative colitis, when you have inflammation to the lining of the large intestine, or Crohn's disease. And in Crohn's disease, you can have inflammation to the lining of the digestive tract, anywhere from the mouth all the way down to the anus. So now I'm going to have Rory speak to you about health concepts. So take it away, Rory.
Thanks, Natalie. So in terms of health concepts, we're going to start by defining a number of different concepts. The first one being gut microbiome. If you think about the bacteria within the gut, it's helpful to think about how it starts when we're born and as we age and how it changes. So when we're born, we have a ton of diversity within the bacteria. And as we age, we tend to lose that diversity, and those bacteria end up starting to looking the same. Diverse microbiomes actually work way more efficiently than a microbiome where the diversity is lacking. So you want all those bacteria to look different. What happens is there's a connection made between the gut and the brain, which is made through what's called the vagus nerve. And because the brain manages things like insulin, mood, hormones, cortisol, inflammation, it's really important that we focus on diversity within the bacteria of the gut. And that's what the gut microbiome is. The gut microbiome describes all those bacteria and how they look within the gut. So it refers to the community of microorganisms that live together, mostly in your small and large intestines. And we do have the ability to control what those bacteria look like. Inflammation long-term, being on medication, stress, genetics, hormones, especially in terms of menopause, those things can also affect the microbiome. So we want to do whatever we can to ensure that the diversity of the microbiome lasts as long as possible. And so through diet, through exercise, and through lifestyle parameters, those things can help more diversity. And one of the things in terms of fiber is diversifying or ensuring that you're getting a wide variety of plants. So the more diversified your diet, the better your microbiome or your gut microbiome. The next term there is prebiotics, and those are basically essential foods that feed your good bacteria in the gut. So examples of those kinds of foods are artichokes, onions, garlic, asparagus,
like popcorn, nuts.
Foods that can be difficult for many people with bowel issues to absorb. We'll talk more about that later. Probiotics are the live bacteria themselves. So those are coming from fermented products, including yogurts with live cultures, kefir, and kombucha. So when I talked briefly about just the malabsorption issues that some people have with functional gut disorders or with ostomies, low FODMAP comes up. It's an approach to eating that's used for people who have issues with absorption. So if they're experiencing very loose stools like bowel incontinence, like diarrhea, or more binding in terms of constipation, bloating, gas, all of those things are basically an indicator that absorption is not working effectively. Low FODMAP is a clinically approached evidence-based dietary modification that we can use that was created by gastroenterologists at the Monash University in Australia. And they found that people that would take out gluten or dairy from their diet would notice that there was some symptom improvement, but long-term they were still having issues. And that's because fructose, which is a kind of carbohydrate, is actually contributing to the malabsorption issue. So FODMAP is actually an acronym for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And that's a group of carbohydrates that may cause digestive upset for some people. So this is clinically evidence-based. And basically what we want to do is for a short period of time, we look at lowering your fructose load within your diet, and then we can reintroduce those foods back in to figure out which foods are hard for you to absorb. And it's very important that there's an individualized short-term approach to this. Those prebiotic fibers that I mentioned on the other slide, those ones, a lot of them are high FODMAP foods. And so if we eliminate all those foods long-term, ultimately it's not going to help prepare that gut microbiome for more diversity. Restriction causes more dysbiosis within the microbiome. So it's really important that we don't stay on low FODMAP long term, but we use it as a method in order to be able to become less restrictive. So after surgery, there are some food restrictions that we should adhere to. So paying attention to what you eat and what you drink is very important right after surgery. Basically within the first 6 to 8 weeks of your operation, that's when food blockages are more, you're more at risk for those to happen. So it's those first 6 to 8 weeks because a lot of those foods contain cellulose, which is very difficult for your body to break down. That's basically a form of fiber. But it's important to know the difference between the two different kinds of fiber. We have soluble fiber and we have insoluble fiber. Soluble fiber is that soothing fiber. It's basically dietary fiber that absorbs water to form a gel-like substance inside the digestive system. So an example of that would be like oatmeal or cooked carrots. Something that kind of binds water or attracts water and is very soothing going through your system. Insoluble fiber helps to add bulk to waste in the digestive system and prevent constipation. But they think about it as roughage, a lot of people, just because it doesn't dissolve in water. So if you look at the difference between the inside of the apple and an outside of an apple, the outside of an apple has that peel, that's insoluble fiber. It's harder for your digestive system to break it down, but the inside of the apple would be more soluble-based fiber where a lot of that water is absorbed. So if somebody is within 6 to 8 weeks after their surgery, having applesauce or a peeled apple is going to be a better option than having a whole apple with a peel. So going more into food choice items for gentle healing, these ones are specific to vegetables. You'll see on the top of the slide that you can see a photo of where Natalie had referred to the ileostomy and the colostomy, which means that these are pertinent to both. So in recommended, and there's a bunch of foods that you can have, this is examples, but broccoli, potatoes, and carrots, ensuring that they are cooked until soft, and maybe vegetable soups, which again are that soluble-based fiber. In the first 6 to 8 weeks of surgery, specific types of vegetables that would not be recommended are more the ones that are high in insoluble fiber, or the fiber that's hard to digest. So salad or raw vegetables, popcorn, corn kernels, and vegetable skin. It doesn't mean that you're never going to have these foods. It's just allowing time for your gut to heal post-op for that 6 to 8 weeks. Fruits, same thing. These are recommended and not recommended fruits for the ileostomy and colostomy. So the recommended are going to be that applesauce or peeled apples. I explained that on the slide previously, only because those are easier for you to absorb. Avocados are soft, bananas, canned fruit. Easier for your body to digest and break down. The nice advantage that the avocado has is not only is it high in soluble-based fiber, but it's also high in omega-3 fats, which help improve healing process and reduce inflammation. So those are nice ones. A lot of foods will not just give you the soluble-based fiber, but they also have added benefits in terms of what they can give you post-op to help the healing and recovery process. Some fruits that would be harder for your body to digest at 6 to 8 weeks post-op would be dried fruits, fruit skins, so that apple peel, grapes, or pineapple. Proteins are really important 6 to 8 weeks post-op. They're definitely going to help with the healing and recovery. Including a little bit of protein at each meal will definitely optimize the healing recovery process. Also important to know that proteins aren't really going to affect the digestion. There's no fiber in protein. So these are great foods to focus on in that 6 to 8 weeks. So some examples of recommended foods are protein from chicken, turkey, beef, pork, even mushy lentils. Mushy because they do have a little skin about them, so it's going to break down some of that fiber while you still get the benefit of the protein. Tofu, cheese and yogurt, the seafood, all of those will be great in terms of omega-3 that again help reduce that inflammation. Not recommended. So those large whole legumes are certainly high in fiber, but they also have that tiny little casing, so they're higher in that cellulose. They may be helpful in thickening stool, but within that first 6 to 8 weeks post-op could cause a blockage, easier to limit those. Tougher grades of meat, wild game and sausage casings, that can be helpful again in thickening stool long-term, but could cause a blockage within that first 6 to 8 weeks. Raw or undercooked eggs are high risk because they can cause food poisoning. You're more susceptible or higher at risk for food poisoning right after surgery, so better to avoid. These are just a snapshot of what is included in the book. The ebook has a lot more examples and explanation in terms of which fruits, vegetables, and proteins you should focus on within that first 6 to 8 weeks and going forward. The next slide focuses on fluid requirements. After an ostomy, hydration is one of the most important factors we need to look at. There's a lot of information on this slide, so I encourage you to either pause it or print it or just look at the ebook as well. This information is in the ebook as well. But the guidelines are there and they're all evidence-based. It's important to see that the differences are between the pediatric and the adult care, even between female
To balloon.
guidelines. It's important to kind of listen to your own body and discuss with your doctor what's going to work for you. But these are appropriate guidelines that you can start at. So in terms of adults, for females and males between the ages of 14 to 18 years, women should have 7 cups per day. That's 1,750 mils. And males at the same age demographic should be 10.5 cups per day. If you're 19 years or older, 9 cups per day for females and 12 cups per day for males. The intake should increase if you are breastfeeding to 12.5 cups per day. I think we skipped a slide there. Signs of dehydration. So there are certain things you can look at if you are getting dehydrated. Headache, fatigue, dizziness, if you get thirsty, dry mouth or lips, if you have sticky, thick saliva, If there's rapid weight loss of more than 2 pounds in 1 day for adults, dark yellow urine, and we're going to have a slide that's coming up that will show you exactly what the shade of yellow would look like. If you're peeing less, changes to your mental status or brain fog. There's a photo there showing reduced skin turgor as well, and reduced sweating. For children and babies, you might see increased sleepiness, sunken fontanelles, and crying with no tears. The rule of thumb is that if you're already feeling thirsty, you're probably already dehydrated. So maintaining that hydration throughout the day is really, really important. So water is best when it comes to hydration. When it comes to replacing fluid in the body, just choosing water is adequate. Generally, we recommend adults to drink 8 to 10 ounces glasses of fluid, but pay attention to the things like what your urine color looks like to ensure that you as an individual are getting enough, or if you're getting too much. Always carry a water bottle with you and refill it when empty. If you have it on you, you're more susceptible to actually drink it. Fluids with electrolytes, there's a lot on the market available right now. If you've been choosing appropriate fluids and are still at risk for high ostomy output or dehydration, then you can use what's called ORS, or oral rehydration solutions. They prevent and manage dehydration by helping your body absorb more fluid. So they'll have all the electrolytes in them that help further with reducing your risk of dehydration. What are appropriate fluids? So just using, again, water, maybe an unsweetened coconut water is a natural electrolyte, broth, decaffeinated tea or coffee, and 100% fruit juice diluted with equal parts of water. So again, you get some added bonus in terms of that.
All right, so I'm going to jump in. Thanks, Rory, for that. And just to talk a little bit about urinary tract infection prevention when you have a urostomy. This is one of the hot topics within this population of people. It's relevant to all of us, really, but especially when you have a urostomy. So one of the most important things that you can do to prevent a urinary tract infection is to drink more water. So I know Rory already reviewed some of our fluid recommendations. And we know we recommend for most adults between 7 and 12 cups of water or fluids a day. Just to remember, 1 cup is equal to 250 milliliters of fluid. So again, those fluid requirements will vary based on age, sex anatomy, whether or not you've been sweating in physical activity with exercise or on a really hot day. So it's really important to discuss what your specific fluid requirements are with your healthcare provider. Some other just good practices is to ensure that you're emptying your urostomy pouch when it is 1/3 full. And this blue line kind of shows or depicts urine, and that's when you would want to empty it. It also helps keep the seal of the skin barrier onto your skin so that pouch doesn't get too heavy as well. You can also consider using a night drainage bag, such as the one pictured here, which can connect to your urostomy pouching appliance. And that will just help keep the urine draining and prevent the pouch from overfilling. Also maybe help you get a little bit more sleep at night because you're not having to get up as much to empty your pouch. You want to try to keep your appliance clean. So not wearing the same appliance for weeks on end, changing it at regular intervals for sure, so that it doesn't start collecting too much harmful bacteria. You also want to select a urostomy appliance that is going to fit snugly to your body to prevent leakage and urine from getting onto your skin and causing irritation as well. And you want to keep the skin around your ostomy clean. So every time you change your pouching system, you want to ensure you're cleaning it with plain water. And if you do use soap and water, ensuring that you rinse really, really well with just plain water after to remove any residue so it doesn't impact the seal of that skin barrier onto your skin. One of the things to note about urinary tract infections is that bacteriuria, if you've ever heard that term, is just the presence of bacteria in your urine. That in itself may not be a true urinary tract infection, but if you have bacteriuria as well as have symptoms of a urinary tract infection, which we'll discuss shortly, then that would be something that would require some treatment. And so what should your urine look like? This is just a chart here showing the different colors of urine. So if you're hydrated, it should be more of a light pale yellow. And then you can see as your urine's getting darker, you're becoming more and more dehydrated. And if it's really, really concentrated, then you could be severely dehydrated and need some medical attention. So always keeping track of how does your urine look. Now, a caveat to that is when you have a urostomy, because there's urine coming out of a small intestine portion that naturally produces mucus, you may notice a little bit of mucus in your urostomy pouch. And that actually, it could be normal. And it can also cause cloudy urine. So one of the signs and symptoms of a urinary tract infection could be cloudy urine, but that could be normal in the case of a urostomy. So there's other signs and symptoms we'll discuss that you would definitely want to look out for. So medications with an ostomy, it's important to note, especially those with an ileostomy, that a lot of different medications may be absorbed in later portions of the digestive tract. And if that medication hasn't had a chance to go through the whole system, then it may not work as it's intended to. So there's medications that are called extended release medications, enteric coated, and time released formulations. They may not work as intended depending on the type of ostomy you have. So it's very important to discuss if with your pharmacist, with your physicians, that you have an ostomy, what type of ostomy, where in the digestive tract is that diversion created, so that they can adjust your medication formulation as needed. Another thing for women is oral contraceptives. They may not be an effective method of birth control for you. So you want to have that discussion again with your physician. And over-the-counter remedies such as laxatives may increase your risk of dehydration. So if you have an ileostomy, it's not too common that laxatives and stool softeners and things like that are given. So again, under the direction of your physician. And please make sure to discuss that with your pharmacist as well. So some of the different problems and how we can manage, and you may have some signs and on a slide. I'm going to talk you through each point here, but again, you can refer to the ebook, which will provide that QR code and a link in the chat that you can click and read it and get a copy as well. And it will be on our coloplast.ca website. So depending on the type of ostomy, some of these issues are more relevant for one ostomy versus another. For colostomy and ileostomy, you can have a blockage. I would say it's more common with ileostomies just because of where that ostomy is created on the digestive tract. Some of the signs and symptoms to look out for is pain, nausea, sometimes even vomiting, dark color urine, decreased or foul smelling output. Those are different signs that you may have a blockage. And how we can prevent those blockages is by referring to your physician recommendations on what you can and cannot eat after surgery. Referring to this ebook for recommendations, avoiding foods that may cause blockages, as well as really chewing your food properly. If it's in that first 6 to 8 weeks after an operation, that's where blockages are higher risk, where they can happen the most, and that's just because of all the swelling in your digestive tract. So making sure you really cook those foods properly, chop them up, and avoid certain things like popcorn, nuts, and seeds, especially if an ileostomy, during that first 8-week healing period, especially. And again, you may be able to tolerate these foods later. It is going to be a trial and error basis, unfortunately. And so you can, if you do suspect you have a blockage, you can try the knee to chest position. So if you're sitting down, you can bring your knees up and hug your knees. You can try to massage the area around the stoma. So your abdomen, you want to give it a massage, gentle massage, because a lot of the blockages happen just behind the stoma. And you don't want to consume any extra fluid or food if you're experiencing no output at all, nausea or vomiting, or you've been blocked and you've tried to release the blockage and you're still blocked. You want to stop consuming anything and you want to go seek medical attention. I always recommend, if you're going to the hospital, bring a few extra ostomy appliances with you so that, you know, if you're changing it or healthcare providers changing it, sometimes they don't always have the appliances you need readily available. Relevant for colostomy or ileostomy, if you're having gas, you can notice that with your pouch starting to balloon, and you might notice increased flatulence sounds as well. And how you can prevent gas is avoiding those gas-producing foods. So different legumes, carbonated drinks, lactose, and can affect certain people. So if you find it makes you gassy, you want to avoid those foods and certain vegetables as well. And you want to eat nice, slowly spaced out meals, chew your food. Smoking and drinking from a straw as well can increase gas production. So how you can manage that is you can release the gas by, call it venting. If you have a two-piece mechanical coupling system, you can detach the pouch from the barrier and then just reseal it. You can go to a bathroom and open up the outlet and just kind of gently press, or you can even press on the pouch if there's a filter, and it can help the gas escape the pouch. One thing I'll note is with pouch filters, they should have a charcoal filter, and that charcoal will help deodorize any smells as well. High output can be an issue, especially with people with an ileostomy, and that's frequent or watery stools, usually more than 1.2 liters in a day. And you may have some signs and symptoms of dehydration, which we spoke about earlier. So if that's the case, if you have high output, you want to limit insoluble fiber foods and consider low FODMAP foods. Again, we want you to consult your healthcare provider regarding that. A low FODMAP diet may not be required for everyone, but it can help certain individuals. And certain foods may reduce high output, such as applesauce, toast, bananas, boiled white rice, white breads, those kinds of things. You want to manage dehydration, maybe that oral rehydration solution. We'll have a recipe for that in our ebook as well you can refer to, and drink lots of water. And consult your HCP if there's a concern, because sometimes this could be related to diarrhea related to an infection. So you always want to rule out the possibility that this is an infection related to your high output. And sometimes some medications can help as well, slow things down. Another concern is odor, and that can happen with anyone with a different type of ostomy. And so some symptoms may be just that annoying odor that you smell, and it may make you feel a little self-conscious or concerned. How you can prevent that is prevention of consuming odor-producing foods and fluids. You want to empty your pouch regularly. You want to change it regularly as well, and ensure you have a good seal. And sometimes there's different filters depending on different ostomies that you have. To manage those symptoms, you want to avoid those foods that increase odor. That could be like fish, eggs, certain vegetables, and certain foods may actually help decrease odor, like cranberry juice or parsley. And there is a pouch deodorant that you can get and put in your pouch, as well as charcoal filters and some medications, but consult your HCP regarding the medications. Pancaking can occur, and that's when the output is very thick and it collects around the stoma, and it doesn't kind of drop into the bottom part of your pouch so that it makes it easier for emptying. It kind of stays up near the stoma. And sometimes that pancaking can actually be so much that the stool starts pushing the pouching appliance right off your skin. leading to leakage. So how you can prevent this is preventing this almost vacuum effect that might be occurring in your pouch by blowing some air into the pouch before you apply it. And you can also use a pouch lubrication and ensure you're having adequate enough fluids. So to manage those symptoms, same as the prevention, we want to increase some insoluble fiber. Again, be mindful if this is before the 8-week healing period post-operatively. And some meds as well may have, and certain foods may act HCP for that. And urinary tract infections. We spoke about it in the context of urostomy because that involves the urinary system, but it really is something that's relevant for everyone. Some of the signs and symptoms include fever, sweating, chills. Sometimes you get pain in your lower back. That could be inflammation of your kidneys. Dark colored, strong smelling urine, sometimes bloody urine. Increased frequency, and cloudy urine. Again, I have a star with cloudy urine because sometimes cloudy urine is normal in the context of a urostomy due to the mucus that's there from the bowel. And again, we want you to drink enough fluids, empty the pouch when it's 1/3 full, keep your system clean. And if you do think you have a urinary tract infection, please consult your healthcare provider. The treatment may require you to have antibiotics. And this is a food and fluid journal that you can use to track the amount of fluids you're having, different foods you're having at different times throughout the day. And if you've experienced any symptoms, and that's really important, especially in that first 8-week healing period, to see if something's triggering you or if it's not triggering you. So there's a QR code here. You can scan it and then have that for your reference. You can print out the food journal or refer to it in the ebook. And now Rory's going to talk a little bit about some tips and tricks.
Thanks, Natalie. So when you're going out to restaurants, it's very helpful to research the menu ahead of time. Most menus are all online, so if you know a restaurant that you're going to go to, check out their menu so you're prepared in advance. There's a couple of reasons as to why this is important. First of all, many of us might have anxiety when we go to a menu or go to a restaurant where there's the unknown. And so knowing what you're going to order before even sitting down alleviates a lot of that anxiety because you know what the choices are going to be. The other reason you want to do that is because then you're able to look in advance and see how you're going to modify the menu, which is super helpful in order to enjoy the experience of eating out without having that anxiety go along with it. So portions are usually much bigger at restaurants than what we are creating at home. And it might be less than you might typically eat. So if you know that it's an Italian restaurant and they typically have a large plate of pasta, then maybe even asking them to give you half the amount of noodles and maybe increase their protein and vegetables so you're not getting too much of something. Balance is key, or you can bring leftovers home for another meal. Limiting the intake of potential trigger foods. So if it's a high fat item, like even in a salad, like a Caesar salad dressing will be quite high fat. Fat can be difficult for a lot of people to absorb. So if you know it's a high fat choice, opting for a salad dressing that maybe is made more with polyunsaturated fats or olive oils would be a better choice. Alcohol can be a gastric irritant. So if you know that alcohol is an irritant for you or a trigger, minimizing how much of that you're doing. And dairy. Most restaurants are all able to accommodate either a dairy or a gluten-free. They are used to many people walking in with sensitivities. So don't be afraid to be that person and ask, hey, I'd like this, but are you able to modify it this way? Most waiters or waitresses have heard way worse. So it's important that you're your best advocate and you're getting something that you know your body will tolerate. Request for sauces on the side. Sauces can be high in fat. They can also be quite spicy. They can also contain high loads of fructose or FODMAPs like garlic and onion. So having it on the sauce at the side allows you to kind of gauge how much you should have and to limit the load. And if you're concerned, having cooked vegetables. Salads can be difficult for a lot of people to break down because of the insoluble fiber. Asking for roasted vegetables or grilled vegetables or vegetables that are in a stir fry, those might be better options for you as well. So there's games and strategies that can help both children and adults practice helpful habits and maintain a positive outlook when it comes to eating and drinking with an ostomy. For example, every glass of water that a child or an adult has encourages hydration. So using the table that we had or the ebook to determine how much fluid you need in a day, and using a tick. For every 250 mils, you get another check or a tick or a star. Those things are really motivating to ensure you're getting enough. Also, when you're experiencing issues with dehydration, you can use it in a similar way that you would with the food and the symptom journal to determine if you actually are getting enough based on the color of your urine. The more data you have, the easier it is to determine what's working and what's not. Counting to 15 seconds when chewing food before swallowing, and then tapping out, clinking your glass, or chewing to music with a steady beat. Chewing is so important as part of this process. One of the reasons that popcorn can be very difficult for somebody to digest is the load in which you're getting the popcorn at the time. Chewing enables you to break that down. So taking your time, nuts, popcorn, raw carrots. The chewing factor is so important. When you see what the food is that's coming through the stoma, if you see whole spinach leaves coming through, ask yourself, did I chew that? Slow down and take your time. There's no reason to puree all food and break everything down or eat cooked vegetables for the rest of your life. If you understand and you're intuitive or aware in terms of how much you have to chew, and you see the output in your stoma is being broken down, then success. So mindful eating can help you relax, enjoy, and appreciate your food and the moment. And that is the same as those tips and tricks I gave in terms of the restaurant. The more you come prepared, the less anxiety you're going to have, and the more you're going to enjoy that meal. Eat often enough that your appetite isn't driving you to eat more quickly, especially during the day. A lot of people will eat less during the day and come home very hungry. Their portions increase, and it's much harder for your body to handle large amounts of food later in the day than it is earlier in the day. So regulate and structure your eating during the day, not just in the evening when you get home.
Great, thanks, Rory. So our mission at Coloplast is to make life easier for people with intimate healthcare needs. And how we accomplish that goal is through a lot of the different activities that we do, like this webinar and providing education. And we also have a patient support program called Coloplast Care. And these are just the elements of the program that you can see. So we have a dedicated website with lots of different instructional videos, how-to videos, how to apply our different sensor and meal products, articles, people like you with an ostomy, their stories that are shared on there. And yeah, so a lot of great resources, travel tips, sex and intimacy booklets you can download, and this diet ebook as well. We also provide personalized emails, and we have phone support as well, so you can speak to a real person. 98 some insoluble fiber, and we also provide product guidance and samples as well. We also have a dedicated area on our website for reimbursement and coverage support. Also, you can speak to someone who specializes in that through our care program as well. And we can help you with locating a local retailer in your area or methods in which you can purchase your ostomy supplies. And this is the phone number for Coloplast Care right here, the 1-866-293-6349. Our hours of operation, our website, and our email, casupport@coloplast.com, so you can email or call. These are our social media channels, so you can find us on all these different channels: Facebook, Instagram, Twitter, YouTube and LinkedIn and follow us, and you can hear directly from much of our ostomy users, or ostomy ambassadors, we call them. A lot of their pictures are featured in this webinar, so you've all seen them. They use Coloplast, and they're happy to share their stories, which is really important. You don't ever want to feel alone when you have a condition, and so it's great to connect with this community. And now we'll take some time for questions, and thank you all for attending today. And thank you so much, Rory.
Thank you, Natalie.
All righty. Well, thank you so much to both Rory and to Natalie for such a fantastic presentation. And I can see there that, Natalie, you're with us here in the background. And again, thank you to you. And you're going to have to pass our thanks on to Rory as well. I've got quite a few questions for you. Are you ready to get into them?
Yes, I am.
Awesome. Okay, so I'm going to try to group these as best as possible. And thank you to those who've asked some questions on here live. So the first question is talking about those who might be pre-diabetic or might have diabetes. One of the questions here is about the BRAT diet, which is suggested to thicken ileostomy output, but might not be suitable for diabetics. Do you have any recommendations for those who are living with an ostomy but might be diabetic as well?
Yeah, I would say first and foremost, if you are pre-diabetic or you have diabetes, it's best to consult, first of all, a diabetes educator, because they can get you connected with a registered dietitian who perhaps specializes in working with people with diabetes, but also finding someone who's knowledgeable with regards to having an ostomy as well. So you have different medical conditions going on, and the thing to note with this question is everyone's needs are going to be very unique. You know, you might need to gain weight, you might need to lose weight, and all those other factors, and you know, your blood sugars may be fairly well controlled, or they might be completely uncontrolled, and you need a full revamp of your diet. So the best step here is to consult the appropriate healthcare providers so that you can get that individualized support that you need. And with the BRAT diet, for those who don't know, bananas, rice, apples, or applesauce, toast is what that stands for. But there's a lot of other foods that you can consume that can help to thicken stool. There's also things like psyllium that you can take as a powder or a capsule. You can add it to a smoothie. You can add it to water. It's clear and it will dissolve. And that as well gels in your system, and it can help thicken your stool as well. Perhaps you might need, if you're really, struggling with high output, and that's why you're looking towards the BRAT diet. The other thing you want to rule out is your high output due to an infection? So first of all, rule that out. And if it's not, then you can start looking at those dietary interventions. Yeah, just foods that are higher in soluble fibers, lots of water. Consider an oral rehydration solution as well if you're losing a lot of electrolytes. And there's specific foods and recommendations that we have symbols for to show if they're high in insoluble fiber or soluble fiber. So you can see our food list and help decipher which foods might be good options for you.
Fantastic. Well, thank you for touching on that. And that brings up a couple different points there. I'll touch on one first here. So you had mentioned some of the powders there, and we had a couple questions. One about taking vitamin supplements. Now, do you typically recommend this? Is this on a person-by-person basis? But could you maybe comment on the use of vitamins for someone living with an ostomy?
Yeah, for sure. So with regards to any vitamins or supplements and your ability to absorb them and digest them, that of course is going to be impacted by where where your ostomy is located in your digestive tract. So if you have like a sigmoid colostomy or descending colon colostomy, where it's on the lower portion of your digestive tract, just before the rectum and the anus, you'll probably be fine to consume all the usual regular dietary vitamins and things like that. But if it's higher up where you have an ileostomy, it may be impacted. So you might need to take things in a liquid form or a different form. So it's important to consult your pharmacist, as well as maybe a registered dietitian or your physician on that to find out what's right for you and what you can absorb. The one thing I want to note as well, and it's also in the ebook, is about vitamin B12. This vitamin is absorbed in the terminal ileum, or so in the lower portion of your ileum. So when I say ileum, that's a portion of the small intestine. So if you have an ileostomy or and that terminal ileum is being bypassed, where B12 is synthesized, you may need a subcutaneous, we call it subcutaneous injection, or an injection in the arm once a month is typical, depending on what your needs are, because when you take it orally, you're not going to absorb that B12, and B12 is important for making new red blood cells, giving you that energy, as well as nerve function. So it's a very important vitamin, and you don't want to be deficient in. So something to consider. If you have an ileostomy, check your B12 levels.
Perfect. Okay, well, thank you for touching on that. That was fantastic. I'm going to switch tone a little bit here. I'm going to ask a question about, I know at the very beginning of the presentation, we were talking about that first 6 to 8 weeks post-surgery there. We have a couple questions sort of grouped on the same category of when do I start, or when can I start reintroducing some foods? And I know you talked about the importance of chewing, taking your time, all this kind of thing, but especially with regards to things like raw arugula or lettuce or kale, things like this. At what point is it kind of starting to get a bit more safe to do that?
Yeah. So just one thing to note again, if you have a urostomy, and you haven't had anything done to the digestive system, other than taking that piece of small intestine. So they do. So when you get a urostomy, they use we call it a conduit, where they use a little bit of small intestine to create the stoma. So there may be some healing there. So you'd have to consult with your physician, but generally speaking, those with the urostomy don't need to worry too much about any dietary restrictions or issues with that. If you have a colostomy, now there's different sections of the colon where this ostomy could be created. So if you're close to the ileum, where the ascending colon is, you might have to be more restrictive with your food initially when you're healing. But if you're on the lower part of the colon, you maybe need to be less restrictive with your food, less chance of blockage and things, because the food has had time to go through most of the digestive tract. If you have an ileostomy, that's definitely more high risk for those blockages and things like that. And you're going to really want to be mindful of what you're eating in that first 6 to 8 weeks. So we have the list with all the different foods. So anything high in insoluble fiber. So human beings, we don't digest insoluble fiber. So we need to kind of break down that fiber in a different way, and we do so mechanically. So chewing our food, cooking, adding extra heat to the food, or cutting up the food in small pieces so that it's manageable. So keeping that in mind, and perhaps avoiding insoluble insoluble fiber-based foods for that first 6 to 8 weeks. Refer to the list so you know which foods to be mindful of, and then start to reintroduce things as you feel better and as you heal, maybe 8 weeks and on. Start to try small portions. Don't just have a huge serving of, popcorn. Maybe try a little bit, but chew your food really, really well. Assess your tolerance, wait and see. Also, those food diaries can be really helpful, because they can track how is your body responding to this food. Maybe you didn't respond well and you want to note that. Maybe you just ate too much of that food, and that's why. Maybe if you had a smaller portion next time, you might tolerate it better. So, and then also maybe you don't need to totally eliminate that food out of your life forever. Maybe you just need a little bit more time to heal. And then maybe you come and reintroduce that food again, noting any symptoms and how you tolerate it. So yes, we definitely have some resources on that, on foods to limit, avoid, and be mindful of. And then we want people to also think more inclusively about food, not exclusively about food, because we all enjoy food and want to eat food, and we want to not focus on what we can eat. We want to also focus on what we can eat.
Absolutely. Well, I love that positive outlook on that one too. I know we've got a couple questions here. Just asking if we can get a link to the ebook at some point. I know we're going through questions, so maybe at
Sure.
the very end, if we can pop up the screen again, or if you can put the link as an announcement, we'll definitely do that for you. So going on to this point here, some people are asking about their kids or their teenagers and preteens here. Are these recommendations pretty much the same from younger kids all the way up to adults? Or is there a big difference between, really the question is here, I've got a teenager who really enjoys pizza and pasta. I'm really concerned about too much bread. Is there a difference in recommendations for teenagers, between children, teenagers, and adults?
So, children, babies, teenagers, they're going to have different calorie needs in their day, as well as they're growing versus an adult who's done that growing. So again, it's important if they're not eating a lot, then what you want to focus on is high calorie dense meals, so that they are getting enough of that energy from their food to really support growth, energy, function. If there's any concern, this is when I would 100% I would recommend you consult a registered dietitian, because it depends on their age, how much they weigh, a lot of different factors, and so really the best person to consult with is a registered dietitian. In the ebook, we also have the link to how to find one, how to locate a one in Canada. But you can also reach out maybe to if you have an NSWOC nurse, physician for a referral, to get you hooked up with the right person to advise best on that.
Perfect. Okay. Well, thank you for touching on that.
Mhm.
I'm gonna switch tones a little bit here. This one is talking about in the event that someone does experience a blockage, at what point would you recommend someone should go to the hospital or should seek a little bit more emergency care with regards to a blockage?
So if you're vomiting, if you're experiencing severe pain, a lot of nausea, that's a sign that, and also if there's nothing coming out of your ostomy, your stomach is getting really, really bloated and hard. That's a sign that you have, a severe blockage or a complete blockage, we may suspect. A partial blockage is when there's still some gas coming out. Maybe the pain's not too bad. You're definitely not vomiting. You're not too nauseous at this point, and there's some liquid output. If in that stage, you might want to try to see if you can relieve the blockage yourself with those strategies we talked about in the webinar, such as the knee to chest position. Most blockages occur just behind the stoma. So if you massage the peristoma area just around the stoma, sometimes that can just be enough to help relieve the blockage. But even if you're getting some liquid output, even if after a period of time you still suspect, you've tried a few things, you tried a warm bath, you tried to go for a walk, you tried to relax, and still nothing seems to be working, then you're going to want to seek medical attention. And I want to also note it's important, if you do have some output, you're not vomiting or nauseous at that point, you could drink a little bit of water. That's okay, but don't eat any food because that can make things worse. But if you are vomiting, really nauseous, don't consume anything at all. Just get yourself to the hospital. If you're able, bring some extra supplies. What you might also notice is your stoma is actually more swollen and larger. So you might have to change your appliance at some point. And if you do, just note you might have to cut it a little larger to accommodate a swollen stoma for just a period of time until the swelling goes down.
Perfect. Okay, thank you.
No
Going over
problem.
to this question here, a little bit, slightly more specific here, but have you ever dealt with a situation, and we're talking about hydration for a while there, where you kind of get more on the other extreme side? You might be drinking too much water, and you've had someone with extremely low sodium intake, or not intake, sorry, but extremely low sodium. They have extremely low sodium. This person was asking, they have an ileostomy and some reduced kidney function. Do you know if there'd be maybe a different recommendation in situations like that for how much water you should drink, or is it more of a nutrition issue usually if that comes up?
Okay, so just to confirm, we're just seeing if we can get that link as well for the ebook. But just to confirm, you mentioned if someone has low sodium, they're having an ileostomy, they're dehydrated, but they have kidney issues.
They
Did you
have
say
kidney issues
Mm.
and ileostomy, and they've had a situation where they had extremely low sodium despite drinking a lot of water, or because they're potentially drinking a lot of water. They want to know if that could potentially be a reason, or if it's usually more of a nutrition issue that could result in
Oh,
low
right.
sodium.
Oh, yeah. That one I'm going to have to recommend you to consult your healthcare provider, especially with the context of kidney issues that can definitely impact your sodium levels. And so the best person to advise you on this medical type question would be your healthcare provider, your physician.
Okay, no problem at all. And
Hmm.
we're gonna go over to the conversation about healthy bowel bacteria here.
Sure.
Someone was just asking about what are some good techniques to restore healthy bowel bacteria. I know some people mentioned yogurt here as well. Are there any options outside of yogurt potentially?
Yeah. So there's different fermented foods, kimchi, um, sourdough bread, things like that. That we have a list of different foods that can help with that healthy gut bacteria as well. Um, and also, you could look seeing if supplements are right for you, if you want to take a probiotic. Um, the evidence there is Rory would be more appropriate to speak on this topic than I. She's much more well versed, so I would recommend to consult a registered dietitian to find out what kind of supplements are the best ones for you with regards to that. But again, I think the key thing is having the rainbow of foods, different diversity in your diet, different plants, things like that really help to support that healthy gut microbiota and increase the diversity. If you're just eating kind of cheeseburgers and French fries and pasta, there's not a lot of you're not introducing that good healthy gut bacteria and things like that. So you want to eat the rainbow, eat the different plants, and we have lots of suggestions on what you can eat in the book.
Fantastic. And I know we're getting almost at time there. If I can just finish off with maybe one more question about
Yeah,
diet and
sure.
nutrition here. A bit more of a conversation about how an ileostomy works as well here. Someone who was just wanting a little bit of clarification with why do people with ileostomies need to be more cautious about blockages when food waste would typically naturally go into the large intestine, but with an ileostomy goes to a pouch instead. I know you had briefly mentioned it there. Do you mind just explaining one more time about the concern with food blockages when you have an ileostomy?
Yeah, versus a colostomy, why they're more at
Yes.
risk. Yeah, that's because as you eat food through your digestive system, it starts off, it goes through your stomach, and then it goes into the small intestine. And the role of the small intestine primarily is to absorb minerals and vitamins. And then as it makes its way into the large intestine, then more water gets reabsorbed. And so that process of a lot of water reabsorption, which occurs in the large intestine, that food doesn't have that chance to go through that process of reabsorbing the water. So then what happens is not only that, but also there's more digestion, there's more gut bacteria, there's more in the large intestine as well that continues to work on that food and break it down even further. So there's a lot of digestion and breaking down essentially that happens in the large intestine that doesn't get a chance to happen when food just goes through the small intestine and out into a pouch. So then sometimes you get food that's partially digested or not digested at all. As Roy mentioned, sometimes you might see that lettuce leaf of spinach in your pouch whole. And so thinking about, am I chewing the food adequately enough? Do I need to cut up my food in smaller slices? Do I need to cook it better? We call it the 3 C's. So chew, cook, and cut. And and you want to really consider that. But it's because that food's not broken down, comes out more whole sometimes, especially if the food contains insoluble fiber, that can block the opening of the stoma and causing a blockage.
Fantastic.
I hope that was
Well, I
clear.
think I absolutely, I'm learning a lot as we go as well here too. That's fantastic. I know we're up to time here. Just wanted to double check. Were we able to get that link by any chance there? We can also always send it in a post webinar email potentially.
Yeah. I just have a message. The book is accessible through the coloplast.ca homepage. It's right below our banner for you to download. So what I can do is I can just quickly grab it.
Perfect. Well, maybe while you're doing that, I'll just say a couple closing words here. The first
Sure.
thing we just want to say is, again, thank you to Natalie and thank you to Coloplast and Rory, of course, for being a part of that presentation. As you can see, and as you can tell with Natalie getting the resources there, Coloplast is able to offer quite a few different resources there. So we encourage you to go check out their website. And I know, Natalie, you had mentioned there's even that option or a link to be able to find a registered dietitian in one of those resources there. So without further ado, we're going to wrap it up for today there. And oh, here, I got the link right here. I'm just going to copy it. So in your little chat area, everybody, I'm going to put it in right now or the Q&A area. I'm just going to paste that link as we wrap up. So you can click on that right away. That should bring you to some resources you might be looking for. Anyways, on behalf of Ostomy Canada Society, we want to thank you all for coming on to our webinar today. I know we couldn't get to every single question, but we hope to be able to answer that again in the future through our blogs, through our upcoming webinars, or even might have been answered already in one of our past webinars. So we encourage you to go check that out on our Ostomy Canada website. We have not announced the date or topic for our January webinar quite yet, but do stay tuned on our social media, on our website, and over email for that next one. There will be a post-webinar survey that will be popping up in your email in the next little while here, so we encourage you to fill that out. Helps us give us some great recommendations for webinar topics and lets us know how you liked or what we can do better for our future ones. So thank you again, Natalie, and thank you again, Coloplast, for such a fantastic webinar. We can't wait to be partnered with you again in the future.
Absolutely. Thanks for having us.
Have a great night, everybody.
Bye. Take care, everyone.